I do. And we would also love to know who is in the meeting in terms of the various health centers. Is that possible, Lorraine?
Oh yeah, of course. So if you want, do you want people to introduce themselves?
That would be great. I
All right.
see Kelly Nightingale up there.
Yes, hi, this is Kelly, and I'm with Valley Wise Health Dental.
That was excellent. That's great. Super. Michelle Gross Panico. Maybe we don't have Michelle back yet. All right.
She might still be on break, but she's from Dignity Health.
Okay, great. Wayne Cottam, you.
How are you?
I'm fine. How are you?
Doing all right. We're hanging in there.
And Wayne, who are you with now?
I'm with the A.T. Still University, Arizona School of Dentistry and Oral Health.
That's what I thought. I just wanted to make
Yep.
sure, but
Yep.
that's great.
Still there.
That's good.
Yep.
Good to hear.
Yep.
All right. Who else do we have? I can't see all the participants from my screen, Lorraine.
We go down, we got Dr. Newman.
Yeah, I'm Alan Newman. I'm the dental director at Sunset Health here in Yuma, Arizona.
Excellent.
I see Ashley James.
Hi, yeah, I'm Ashley. I'm with the Community Health Centers of Yavapai, and we offer dental services.
Excellent. Thank you.
Let's see. Arturo Sosa. All right, then I see Grace.
Hello, I'm Grace Angulo, and I am the department manager at Mariposa Community Health Center.
All right. Excellent. Did we miss anyone?
I think Mr. Wilcox.
Dr. Wilcox?
Okay.
Maybe he's not back yet.
Maybe not. He's from North Country Healthcare, Community Health Center.
Okay. And Arturo Sosa is from which community health center?
No, I don't remember.
Okay. And then was there anybody else that we're missing?
I think that's all.
Excellent. Excellent. Thank you so much, Lorraine. And thank you everybody on the line for introducing yourselves. So Eric and I have an idea of who's with us today. My name is Sandy Perez. I am a consultant for First Things First in Maricopa County. We're going to talk a little bit about that project today and hope to pique your interest. I have been a clinical psychologist in Arizona for over 25 years, but was first exposed to the oral health field when I was in a philanthropic position with the Legacy Foundation, followed by over 10 years with Delta Dental of Arizona Foundation as their executive director. And in that position, I had the opportunity to work with many dentists and hygienists and community health centers around the state as we try to improve oral health for all people. I left that position about 5 years ago, moved to Flagstaff 3 years ago almost, and have been working for First Things First since then. I'm going to let Eric introduce himself, and then he's going to kick off our very short presentation because we want to leave time for some questions at the end. So without further ado, Mr. Santiago, the floor is yours.
Thank you, Sandy. My name is Eric Santiago. I'm currently the regional director for the Northwest Maricopa region of Maricopa County, and the representative, the lead regional director from all the 6 regions that represent Maricopa County, which are the Northwest, Southwest, North and South Phoenix, and then on the east side, East Maricopa and Southwest Maricopa. And although what we are about to talk about is primarily within Maricopa County, and I do realize that there are some folks from other parts of the state. I do want to make the point that this particular work is a system level, is at the system level change work, and there are other regions within the state that are also part of our dental oral health strategy at First Things First, and also in similar reviews as far as our work around oral health. So the word will be spread around with the rest of the staff per se. So for those of you that are not necessarily familiar with First Things First, so we are a voter-initiated statewide organization, meaning we are actually a governmental agency, although with our own unique structural organization. We have a board that is actually appointed by the governor, and the state is divided among 28 regions. Out of these 28 regions, there is also the inclusion of tribal regions. I believe there are 11 of them throughout the state that are part of First Things First, and we all our work is inclusive. We don't necessarily have a sort of a subdivision of First Things First that keeps the tribe with its own group, although we do when we talk about policy and things of that nature, we definitely have to consult with the tribal councils and so on. So, but again, 28 local regions within the state, and out of that, about 11 represent tribal area regions. Some of the unique things about our agency is the fact that each council has a component of council members. These folks are volunteer. The only requirement for them to participate in this council is for them to either work in the region or live in the region, so they are familiar with the issues about early childhood, so they can have a better understanding and be able to advise the agency on certain policy decisions. And they're also the body within First Things First that also decides how the monies are invested in each region through a strategic planning process and the implementation of strategies. Sandy, can you switch the? So when it comes to the oral health commitment that we have, although in this slide it talks about 2019, I am one of the very first regional directors. So I've been with First Things First since 2008. And as I recall from the very first funding plan that it was implemented, oral health has always been a component of our strategies around early childhood development. This particular work that we are embarking now is more at the system level change. So This comes out of a report that was commissioned by First Things First on the status of oral health in the state of Arizona and how it relates to the population, to our target population 0 to 5 and families. So currently we have, and again, this is the statement of our principle that guides us through this work, right? Is the system changes about shifting the conditions that are holding the problem in place, meaning since we've been investing in oral health programmatic strategies, we are at a point that we have to pause and say, is the work that we're doing effective? Or is there any other way that we can look at this and make and approach the issues of oral health in the state of Arizona among children 0 to 5 that not necessarily includes the work that we have been funding ever since. Go ahead, Sandy. So right now with Sandy and I, we are working is a cross-regional effort, meaning among the 6 regions, we share similar strategies. So from time to time, we come together and see if, number one, our investment is up to scale by combining our funding across the region. And basically, when we talking about cross-regional, I mean, basically we are talking one zip code to another. There is a highway or there is an avenue that actually divides one region from the other. However, we have transient families that move from west, east, and vice versa. So we want to make sure that services that they were able to access in previous regions is still accessible to them. So this particular approach, the uniqueness about this is actually Dr. Perez, Sandy, put together a committee. Actually, it was composed by council members. And they went through about a 6-month kind of process in which they look at the recommendations that came out of the 2019 report and kind of streamlined to what was feasible, practical. They went through a study whether this was a short-term approach or long-term and the different weaknesses and strengths of the different approaches. So at this point, we are embarking in the implementation of 3 main recommendations that came out of that work, and in which Sandy is also the consultant in working for the implementation of these recommendations.
Thank you, Eric. So we wanted to just briefly give you an overview of what the 3 recommendations were, but the one that we're most focused on for this discussion is this recommendation of promoting medical and dental integration in a variety of health centers, but specifically looking at the FQHCs in the state of Arizona. And in this piece of the project, those that are in Maricopa County and that are within the 6 regional councils. And right now I know that Valleywise and Dignity Health would be the 2 that would be directly impacted of the people that are on the call today. And again, as Eric has mentioned, the focus of this work is not direct oral health service work. There has been funding from First Things First from the beginning of the agency for direct oral health exams, screenings, fluoride varnish applications, and oral health instruction. And that is covered in a different strategy and funded, and that funding allocated by First Things First by region for those direct services. This is a separate effort to look at what are the conditions in the oral health delivery system that could be promoted, encouraged, adjusted to make better oral care delivery possible for the birth to 5 population and for their families and expectant mothers. So that's really the overall population we're looking at. And we're looking for projects in the health centers that you either are already doing, would like to do, would dream about doing, but don't have the funding for. Projects that could be sustainable financially over time and institutionalized into your setting, and things that really focus on integrating oral health services into medical and primary care at the health center level. What our committee found was the QHCs are uniquely positioned because you're already, most of you, integrating behavioral health and have oral health services, at least in some of your locations. And I know many of you have many locations that are affiliated with your health center. So that is the primary recommendation that we are looking at in this conversation today. They also wanted to see that those messages and that care coordination for expectant moms was built into the recommendation because they felt that was really critical. We understand that dental care is not an access covered benefit at this time in Arizona, and that many of our moms have very fragmented oral health care as a result of that. But the committee also felt that was really important in trying to impact the mom who may have more children down the road, whose oral health, she may not understand the value of it and the importance of it, and also to impact the baby's delivery and then the baby's oral health as they develop. And we've listed a few of the things here on this slide that I think most of you probably on this call are very familiar with. So that is the primary recommendation we wanted to talk to you about today. The other two recommendations that came out of the committee, one is to partner with Access and the health plans in a more integrated, comprehensive way to work on oral health. And that is something that Eric and his team at First Things First are exploring now. And the third was to use First Things First as a vehicle for a statewide oral health campaign to raise awareness, raise the importance and value of oral health, particularly in the birth to 5 and expectant mom population that they serve. So the next steps for this project, and I hope I'm not talking too fast, Lorraine, I know we're on a pretty serious timeline here, was that if any of you on this call today would be interested in meeting with Eric and I and taking the next step of exploring conversations, specific projects, we would be just thrilled to meet with you. We're already meeting with a couple of FQHCs that aren't on the call today who are in the region. And we'd like to look at the next state fiscal year for the beginning of some of those projects. So that would be state fiscal year 23. Those projects would need to be approached by different regions. So as we work with each health center, develop 2 or 3 projects that can be then presented to the councils, approved, and we begin to move forward at the end of the summer. With that, I'm going to stop and open up the floor for questions. And hopefully you guys can hear me. I just got an unstable internet message as usual.
Yeah, it happens.
Any questions? I think I'll stop sharing here. All right, kid.
I do have a
Kelly,
comment.
I'm sorry.
I do have a comment to also make the fact that our work outside of oral health, we do have within the regions, we do have other strategies that do have cross approach outreach to families. So in this particular instance, Valley-wise, we have a number of regions within Maricopa County that have a care coordination medical home strategy funded with Valley-wise, and that will be, I'm thinking that will be a very natural collaboration between the medical approach that we, having, and also with the dental as well. So I'm just kind of, thinking out loud.
Absolutely. Kelly, can you hear us? It looks like you're off mute. Maybe not. All right. No questions at all.
Well, I have a question.
Okay. Dr.
So,
Newman?
yeah, I was curious. I was talking with our director of behavioral health, seeing what the dental could do with, have you done any behavioral health initiatives with dental, as far as the patients that the dentist sees, where they can work together? I was going to have a conversation with the director, but I just thought maybe you had some ideas before I looked into it further.
Well, I could tell you that right now, when it comes to behavioral health, we attain to that through our home visitation strategy, and also through our, what we call our Quality First program, which is the program that supports, gives technical assistance to licensed child care centers. And we have a program that has, among the different technical assistance that we provide, it does attends to behavioral health. But when it comes to dental, no, our primary work so far has been primarily just the screenings, the For Advantage, and in the case that we find a child with urgent tooth decay, then we also assist the family in finding a dental home. But that's, that's kind of the picture that we have right now. Not to say that could be changed.
So you don't have a view of a behavioral health, a medical behavioral health, dental collaboration?
No.
Okay.
Okay.
All right.
Not for
Thanks.
first, Dr. Newman, but I do know that some of the health centers have been working on the integration, obviously, primary care and behavioral health, but there are also some looking at the dental and behavioral health integration. And I know that motivational interviewing, of course, one of the techniques specifically in working with chronic health conditions. And again, that's outside of the birth to 5-year-old population that First Things First serves. But I do know there's some efforts that are focused on behavioral health, and we could probably talk about those offline.
All right. Thanks. Thanks, Sandy.
Absolutely. Absolutely. It's really important that we don't keep segregating the mouth, the brain, and the body. And so really trying to work on that integration. Obviously, with this effort, we're working on trying to get the oral health into the equation, which is often not even thought about, but equally important to bring all three, behavioral health, primary care, and oral health together.
Yeah, I even want to get
Any
behavioral
other-
health involved with the interviewing of providers. I think they have a slant on things that that our interview process may not pick up. So I just think behavioral health should be involved with a little bit more than what they are involved with, at least at Sunset Health.
I think that's awesome. And as a psychologist, needless to say, you're speaking sweet music to my heart. So I know we've got a lot to offer in a primary care setting. So I think that's fabulous in a number of ways.
Yeah, just don't know how to start. Really don't know how to start. So, all right, maybe we can talk offline and get some ideas. Thanks.
Absolutely. Absolutely. I'd be happy to. And I'm really pleased to be a board member for North Country Healthcare. That started for me last year. So I'm continuing to learn as an individual and a professional in the community about how the federally qualified healthcare centers work and the intricacies of it. And I know it's very extensive. So we really thank you all for your time today. Lorraine has our email contact information. I'd love to reach out to Kelly and to Michelle specifically, and maybe Wayne, who I know are in the regions, in the 6 regions that we're talking about today specifically. And we're also hoping, as Eric mentioned, that this effort's going to spread statewide. There's already one region, Navajo and Apache counties are one region of First Things First that are already working on this oral health integration work at a systems level. So we're hoping to see this spread statewide so that this could be offered at all of your different locations over time. So wish us luck.
Thank you. Thank you both.
Thank you, Lorraine.
Thank you.
And feel
Thank
free
you.
to stay for a little
Great
longer. if you'd
weekend.
like. Thank you.
Thank you.
Okay.
All right. So, Dr. Gilji, I know we took some of your time for the presentation, so you still have time. We still have till 1, so
Okay,
feel
perfect.
free to not rush. So our next presentation, we're going to hear about Mountain West Surgery and their services that they have. So if you want to share your screen, I think you have the ability to do that. There you go.
Okay, is it Sharon? Hello, everyone.
Yes.
My name's Dr. Gilji. I am one of the founders of Mountain West Surgery and Sedation. I'm just here to talk a little about me and a few of the doctors that I work with, what our experience has been, and see if there would be any way to collaborate with and service your communities that you guys service. So kind of what we do, we provide comprehensive oral surgery solutions to dental offices, whether they're CHCs or private dental practices. We go to all, any and all. Last year, me and my fellow, one of the other doctors I work with, we traveled to 5 different states working at a variety of CHCs and private dental offices, doing comprehensive oral surgery, really building it from the ground up. It was part of an oral surgery internship where we worked with 6 or 8 oral surgeons and a few general dentists. And it was headquartered out of Nashville. And what we found was that the community health centers would be referring, the providers from the surrounding areas would be referring into Nashville for complex oral surgery procedures, whether that's wisdom teeth, frenectomies, tongue ties, any and all oral surgery services. And what usually happened was there wasn't enough providers in Nashville that accepted the state plans. So what our group did is we went directly to those CHCs and provided oral surgery in-house. So we provide high volume oral surgery and sedation with, we bring in surgical nurses. They are experienced in ASCs and anesthesia, preoperative, postoperative, and really do a lot of the heavy lifting and help us have an efficient and safe day. So problem that we found in Tennessee, Kentucky, Ohio, was that what happened was 16-year-old kid comes in, painful wisdom teeth, they're not going to erupt, and they go to their community health center. The dentist would say, yeah, you need your wisdom teeth out. Here's some antibiotics. we'll send you into Nashville, an hour away, and go ahead and get that taken care of. Here's a doctor that takes the state plan. And the patient would go pick up their antibiotics, the teeth would calm down, they'd call the office, and the office would say, yeah, we do take your plan, but we only take it 1 day a week. And so we're booked out for the next 6 months. Patient would schedule the appointment or not schedule the appointment, but 90% of the time they wouldn't show up. Fast forward 5, 6, 7 years, the patient would be 25 years old. The back teeth would be damaged with cavities, or there would be a severe case of pericoronitis. The patient would be rushed to the hospital, and the oral surgeon would have to take care of him there, costing, which would put tremendous strain on the hospitals and the ASCs. So what we look to do is increase access to care for oral surgery procedures in Arizona. Typically what we supply, since we're running short on time. Basically, we bring the doctors, we bring nurses, we bring crash carts, patient monitoring, emergency medication, surgical instruments, permitting, and we ask the offices to provide 2 to 3 dental assistants, depending on the needs of the clinic, and any disposables, as well as billing and front office support. This is our supply list. This is all we need. We bring the rest. This is a patient flow map. Basically, how our workflow goes. The home office doctor says, hey, we need oral surgery. The assistant fills out the referral slip. They get scheduled on an oral surgery day. This is actually for some of the private offices we work for, so it's a little bit different because they do not have an integrated EMR, EHR. But from my understanding, most of the community health centers we talk to in Arizona do. But essentially, pre-auths are sent out, and we go through the patient's EMR. Or if you guys don't have an EMR, EHR integration into your dental offices yet, we have something called surgery forms. This is our version of an EHR. Essentially, it's a checklist for patients to fill out. It's HIPAA compliant. It goes directly to, it is stored on the cloud. It's directly sent to our clinic, or our nurse, our office, and our nurse reviews the health history, contacts the primary care physician as needed, and gets the proper medical consults completed for a safe surgery. And at that point, this is also, at the same time, this is sent to your guys's email, as long as it's HIPAA compliant, as long as your email is, HIPAA compliant, which I'm assuming they all are. And that really provides collaboration between us as the surgical team, the primary care of the patient, and the home office and the doctors of the home office. It minimizes cancellations. It's a real bummer when you show up to a clinic and the patient has traveled 45 minutes and you have to cancel surgery because something wasn't accounted for in their medical history. That is no fun for anyone. This is what we do to maintain safety. We have essentially on the left-hand side here, we have an office checklist. So on our surgery days, the assistants go through and make sure that the chair's working, the suction works, the lights turn on, the chairs lean back. And then on our side of things, we check that, as well as our nurses go through and ensure that we have the proper medication, surgical devices, and monitoring devices. This is what is done for every patient. It seems like a lot, it seems overwhelming, but it really becomes second nature. It just divvies up what's the front office's responsibility, what the assistant's responsibility, what the nurse's responsibility is, what the doctor's responsibility is, and what the nurse's responsibility is to get the patient from preoperative to discharge safely and efficiently. We go through this on a training day with the back office. And after 1 to 2 surgical days, usually this becomes second nature and we don't need to use these anymore. Here's a day that me and one of the doctors completed. You know, it's primarily wisdom teeth. Sometimes we do a little bit, we do whatever is needed at the clinic. This was one of the larger CHCs we worked for in Tennessee. There was, you know, this is 43 sedations. There was two doctors, 4 nurses, and a team that the surgical group that we were working for had worked with for the past 20 years. But this is like what can be completed in a day in a safe and efficient way. This is typically how we schedule our days. And once this day is filled up, me or one of the other providers or both of us go out and do all the oral surgery for your guys' clinics as needed. This is a referral sheet. You guys, I'm sure you guys have something similar. This is just our referral sheet that's sent to us that the clinic fills out. So a benefit, some benefits working with us. We're able to increase access to care, essentially. We're able to meet more needs of the community. There aren't 16-year-olds just placed on antibiotics waiting for, you know, their teeth to, you know, cause serious infection, you know, when they're 25 going to the hospital for these, you know, minor surgical procedures. We can train assistants in complex surgical procedures, but what it boils down to is we meet more needs of the community. Also, your clinic is able to, what we were able to negotiate in Tennessee was increased reimbursement for you know, the clinic fees per visit due to providing more services at each clinic. As far as integration, it's pretty straightforward. We go in, we help any questions with billing or coding. Usually CHCs, what we found, are pretty on point on that sort of stuff. There may just be, you know, some different codes used, you know, with the oral surgery. And our doctors and nurses go through and spend a lunch teaching the doctors, you know, what we need from them, what post-op could look like, what needs to be, what we need to take a look at, and what, you know, hey, this is how you take care of a dry socket. Me and my partner, the co-founder, we moved out here in September. So we're just getting started and we're just in the credentialing process. But if you have any questions, I will type in my email for everyone. And I'd just like to open up the floor for any questions. I'd love to hear what you guys are doing as far as oral surgery. Most of the clinics we have talked to, they just send a referral because I think there's 20 surgeons that are doing that accept access, and I called most of them, and most of them are booked out or no longer accept the state plans. So I'd be interested to see what your offices are doing, and feel free to reach out. That's my email and here, and I'll also leave my contact number in the notes as well. And feel free to reach out. Does anyone have any questions?
A couple of questions.
Yeah.
We're in Yuma, Arizona, Sunset Health, and we had 2 oral surgeons a couple of months ago.
Oh, Dr. Newman, I think I lost you.
Yeah. Give him a minute, probably needs to reconnect. And this PowerPoint, can I share this with the group?
Yeah, yeah, of course.
I'm interested, you bill mainly access. Does the site get reimbursement?
Yes.
How does that reimbursement division work?
So typically what we have done is take a percentage of the reimbursement. That is what we did in Tennessee. I am not sure how that, since we're, just in the process of getting credentialed with Access, I am not sure. There's a lot of legal ramifications with working with state Medicaid and contracting at your offices. We would have to have legal look into that in terms of are we able to independently contract at your office, or do we need to come in as employees, and how that all works. Is there at your clinics, are you guys receiving the Access, fee for service fees for your procedures, or are you guys paid on the PPS model?
I'm not an FQAC, so I'm not exactly sure what they're getting, but
yeah.
I'm at the dental school, so we take Access, but no, what was the percentage in Tennessee?
In Tennessee, well, since surgeons were in Nashville, we're charging about $2,000 for a set of wisdom teeth, and that was their insurance price. The reimbursement was about $1,000, and we would take about 50%. But it really comes down to who pays for what, because we are typically, our contracts range from 40 to 50%.
Thanks.
Yeah.
Looks like we lost Dr. Newman.
Like he fell off the edge of the world down there.
Are you at Midwestern?
No, I'm at AT still.
AT still? Okay. Well, do you guys have a surgeon on staff that typically sees your Access patients, or for wisdom teeth and frenectomies, tongue ties?
Yeah, we see a certain percentage of those, but some of them we refer out.
You refer out? Yeah.
Some of them we do.
Yeah.
Yeah.
So I froze out. Where did I lose you?
You had a few surgeons coming out to your clinics.
We had 2 oral surgeons in Yuma. One of them passed away a couple of months ago, Dr. Spangenberg. And I was just wondering do you do the billing, or does the company do the billing?
The company typically does the billing.
So you need a contract, some kind of MOU or something with the. Okay,
Yes.
I'll contact you afterwards and ask you more questions, but
Yeah.
I was saying when I got frozen that this is one of the most exciting things I've seen in a long time as an oral surgeon who'd be willing to come to our community to help out our patients. So,
Yeah. Now, I will clarify, I am a general dentist, and my partner is a general dentist. We did a oral surgery internship.
so you're exodontists.
We're exodontists. Yep.
Got it. Okay, that works for me still.
Yep.
Okay, cool.
Yeah, there was a tremendous need in Tennessee. The guy that was our clinic director, he was actually the residency coordinator and an oral surgery fellowship director for the past 20 years. He ran the first state approved oral surgery ASC in Tennessee. It was super high volume and they just couldn't see all the patients. You know, they were the busiest ASC in Tennessee. So part of his residency and fellowship was going out into the communities and servicing these clinics, because getting a set of wisdom teeth done in a clinic is one thing. Getting it done at an ASC, that costs a lot more. And then even a step up from that, sending that patient to the hospital in the emergency room costs even a lot more. And so he decided that, and for the past 30 years, he has been going to these community health centers and providing care directly at the site.
Did you have a phone number you put on the screen as well?
Yes. Here.
I lost all that old stuff.
Yeah, my phone number is 360-867-8617. And I'll go ahead and share my screen again.
Thanks. Thank you.
Yeah. Does anyone else have any questions? Dr. Newman, do you have an integrated EMR EHR?
We do.
You do? Okay, awesome. So that was a big hang up in Tennessee, where we had to cancel surgery sometimes. So if you guys have an integrated EMR EHR, then that saves a lot of stress. Cancellations.
We use next gen.
Next gen. Okay.
Great.
Thank you. Okay, if no one has any questions, our email I left in the notes. It's info@mwsurgerysedation.com. And my name is Dr. Gilgy. My phone number is 360-867-8617. Thank you guys for your time.
Thank you.
Thank you.
All right, so let me check in. Dr. Wilcox, are you back on the meeting?
I am on just right now for just a sec.
All right. And Michelle, are you back too, or are you still out? All right, well, if you're talking, you're on mute, or you're off the meeting. All right. So we'll go into our last section. So I reserved an hour just to have an open discussion and round robin of sharing. So I'll open it up to you all to share any challenges or successes or any questions you might have for everyone else. So I have one announcement is we received an email from the National Association of Community Health Centers, NAC, for kind of a save the date. They're going to start a dental therapy peer learning community. It's funded by Pew. And they're inviting PCAs and health centers and national partners to participate. And I think their first kickoff is scheduled for Wednesday, March 30th, from 1:30 to 3:30 to 3 p.m. Eastern. They don't have registration for that yet, but it's more like save the date. So if you're all interested, I'm going to send that out when they have that ready. And if anyone's thinking of something to say, also for the training this morning, I tried to get the continuing dental educations for these trainings. However, this one is a little bit more difficult since we're missing some documentation. So the survey that I'll send out at the end, it still has information for you to fill out to get those credits, just in case I do get it. But as of now, it might seem like a no, but I still left it in there just in case that we do get it credited. So just an FYI.
I did have a question for some of the other community health centers, specifically those in Maricopa here. What are you guys doing as far as oral surgery? Do you guys have oral surgeons come to the clinic, or are you seeing many patients, getting those procedures completed? Or what are you guys doing at a provider level to treat those patients?
This is Kelly. Here at Valley Wise Health, we refer out to Valley endodontists mainly.
Okay, and that's for okay.
Or oral surgery and endodontist.
Okay. Okay, and are they able to see your patients relatively soon? Like, are they able to see the patients in a timely fashion? Not 6 months out, but a couple weeks.
As far as I'm aware of, yes. And
Okay.
they take most of the access plans. I think there's one they don't take.
Okay. Good, great, thank you. We are in the process of getting credentialed at a clinic, and I will getting credentialed at a home-based clinic. Some of those we're just in the waiting process right now. So I'll get some of your guys's contact information and emails from Lorraine, if that's all right with you guys. And when we open up our clinic, if you guys don't want us to come out to your clinic, you guys will have another option. We'll probably go out to some of your community health centers and meet some of the providers, if possible.
You can open one in Yuma. There's a free spot right now.
Okay, Yuma's first on the list.
Okay, good.
Any other general discussion or questions?
I'm so sorry, I was a little late. Is it general questions or general questions about something specific?
No, nothing specific. Anything you'd like to share?
I just wanted to touch on the subject of teledentistry. If anybody is doing any success, any best practices. And I'm not quite sure if we have only dentists or general medical as well, or is it just public health? So just kind of see if anybody has any words of wisdom. in that area.
No one else is doing teledentistry. There are other few health centers that are doing it that I could give you contact for.
That would be great. Thank you.
Yep.
Hi, this is Vishal Kaplan.
All right, so any other general discussion? I know that we've lost a few people over our 4 hours, but anything else? All right. Okay, so I guess we'll end early since we have no further discussion. Dr. Wilcox, if you had anything to add, it seems like we're coming down on questions and discussions, so we'll probably end a little early today.
I heard you say my name, but I didn't hear the content.
Yes, that we'll probably end a little early since we don't have a lot of discussion or questions here coming on at the end. All right.
Let's all go out for ice cream.
All right. That sounds
I
great.
know it's about 63 degrees in Flag. It's time for ice cream.
All right. Well, thank you everyone for joining today and participating all day and in the training. Hope you all have a good weekend, and I'll follow up on email with all those different resources that were provided today. And I sent the survey link in the chat, but I'll send it via email as well. So thank you again, everybody. Have a good weekend.